Dr. Marquez here at Marquez Dental. We're doing our, what is this, our third or fourth Facebook Live. So today's topic is going to be really interesting. I apologize for the late start, but we're here, so that's important. This is a pretty good subject. I think you're going to enjoy it. We're going to talk about sleep apnea, sleep breathing disorders. I'm going to describe what it is and explain what we as dentists can do. Carmen Althoff is here. She's my dental hygienist of how many years?
I've been here over 22 years.
22 years, long time. That's kind of weird because I don't think I've been in practice that long.
Yes.
But so she's going to interject. She has a lot of good information. She went to a course
In myofunctional therapy last year, and then this year, comprehensive.
A few weeks, a couple of weeks
Yes.
ago. So let's get into it and let's talk about sleep breathing disorder, more specifically sleep apnea. But when we talk about a sleep breathing disorder, we're talking about an airway that hasn't grown and developed the way that it should, which is really a very, very, very common problem. Just think about it. Look at all the sleep clinics that we have today. When did we see sleep clinics? Like maybe 10, 15 years ago. You didn't see it. It wasn't common. But now you see them because we're becoming more and more aware of it. Not because it's becoming a bigger problem, but we're beginning to recognize the problem. And so what is a compromised airway? It's an air tube and the way you breathe. And the analogy would be, well, what would be easier to breathe through? A straw, a drinking straw, or a water hose? Well, for sure, a water hose, because there's less resistance, you breathe more freely, you're able to oxygenate better. You could still breathe through a straw, but you're going to be compromised. So,
And it's going to be harder.
it's going to be a lot more difficult. So when we look at sleep breathing disorders, we have a whole continuum. On one side, we have what we would consider normal breathing. On the other side is severe sleep apnea, but there's everything in between. So severe sleep apnea, what happens? People die. And so, but there's everything in between, and it's going to affect our health and our well-being. In essence, what happens if you can't breathe, oxygen is our most important nutrient, and just don't breathe for 4 minutes, and what happens? You're gone. So, breathing is critical. Getting oxygen is critical. Just like food, you gotta eat. You need food, because if you don't get food, you die. Now, of course, it takes a lot longer to die. Certainly not 4 minutes, but you need food. On the other hand, there's a couple of things that can happen. What happens if you don't eat quite enough? Well, you'll still live, but your health will be compromised. What happens if you eat too much? Well, there can be problems there too. So with breathing, you can be on an oxygen diet of sorts. You don't die, but certainly your health is going to be affected. And the contrary is true. We won't get into it a lot, but if you overbreathe, you're going to have issues in oxygen exchange, which is
shallow breathing.
Asthma is certainly linked to overbreathing, if you will, but that's a different subject. So is the problem sleep? Is it a sleeping disorder, a sleeping problem? Is sleep breathing disorder a sleeping problem? Actually, it isn't. It's a breathing problem that affects our sleep. Symptoms are very subtle, but waking up at night is not normal. Our sleep cycles are very precise. they go through different stages of sleep, starting from stage 1, going into 2, 3, finally deep, 1, 2, and 3, REM sleep, and then it starts a cycle over. The REM sleep gets longer over the period of time that you're sleeping, but it's cyclical and continuous. And throughout that time, it's performing very serious housekeeping, if you will, to our entire body. So we talk about the pillars of health. The pillars of health are going to be, help me out, nutrition, exercise, stress, and sleep. Any of those things compromise your overall health is compromised. So what happens when you get a good night's sleep? How do you feel?
Refreshed.
You feel refreshed. You feel energized. You can even think better. What happens when you don't sleep well? You're foggy. You're not clear-headed. And there's a reason, because during sleep, not only is our entire body energized, if you will, but there's a lot of housekeeping that occurs up here in the brain. A lot of housekeeping that's removing toxins from our brain. And it happens only when we sleep. The brain is the only organ in the body that cleans itself.
It's just
everywhere else we have our lymphatic system. It's constantly cleaning out waste products, but in our brain, it only happens when we're sleeping. So in actuality,
if you don't get enough sleep or enough oxygen, you're not detoxing.
You're not detoxing. You're not cleaning. Your cerebral spinal fluid isn't cleaning out what's called amyloid proteins or waste product from your brain. And guess what happens? What do we see in individuals that have Alzheimer's and dementia? We see increased buildup in the amyloids or the amyloid proteins, the waste products. So it's thought that this buildup is very much related to Alzheimer's and dementia. A lot of research going on in that. So sleep is important. It's part of the pillars of health that we're talking about. Inflammatory disease is so very common in modern man. Inflammatory disease wasn't much of a thing that we would hear of years back, but we do hear quite a bit. Everything from high blood pressure, diabetes, periodontal gum disease, just all inflammatory diseases. Metabolic syndrome, maybe you've heard of a new disease that they call metabolic syndrome, but it's stress on the body and then different systems that then are affected. So again, sleep breathing disorder, in particular sleep apnea, because we refer to sleep apnea because it's the extreme of sleep breathing disorder. It's detrimental to our health. This is an astonishing statistic that to me really caught my attention. Is in the US of A, there are 735,000 heart attacks in a year. That's over one a minute, every minute. You know, we've been talking here for how many minutes? 5 minutes. We've already had about maybe 8 heart attacks in the whole US of A. This is a scary statistic. Of that 735,000, 610,000 result in death. 610,000. This is another scary statistic, is of that 610,000, one every minute, that result in death, half of those, or really more than half, about 310,000, are sudden cardiac death. That means I didn't realize I had high blood pressure. I didn't realize that there was any problem. Just one day I had heart failure. That was my first time that I realized that I had a heart issue, a cardiovascular issue, and it results in death. What's significant is when they look at these cardiovascular sudden deaths, the majority of those have sleep apnea. So very strong correlation. So is sleep breathing, or rather breathing, is it important? Absolutely. Again, everything from Alzheimer's to dementia to diabetes, high blood pressure, cardiovascular disease, asthma,
allergies.
you know, even symptoms in children. I don't know if y'all can see this back here, but here's a list of symptoms back here in children, even ADD, ADHD, bedwetting, behavioral issues, you know, we'll see that in children. And it can be attributed very often, not always, but very often, to sleep breathing disorders. So, an important topic, and why in the heck am I here, a dentist, talking about that? You know, this sounds like a health issue. Well, dentistry certainly deals with health, but we're in a unique situation where we can identify risk factors. I think, Carmen, we've learned over the years that we look at people's mouths and we can see the way they present, and we start thinking of certain things. For example,
Mouth breathing, we can see their
mouth
gum tissue
breathing,
is.
gum tissue changes, periodontal gum disease, strong correlation,
Acid erosion.
acid erosion.
Our
You
teeth are
see
worn.
teeth wear, teeth
And
grinding. Those are signs of sleep breathing disorder.
Biting their
and-
tongue, and all of a sudden in their cheeks
and, yes,
starts
and-
happening.